Assalamu alaikum. This article talk about soft and hard tissue remodeling after endodontic microsurgery. A cohort study done by Hajar, Adham, Azim, and their colleague in December 2020. They state that soft tissue management is an essential part of endodontic microsurgery. Attempts are made to achieve adequate soft tissue healing without a scar or gingival recession that may negatively impact the aesthetic appearance of the periodontal supporting structures, and the most common flap design used in the surgery are intracircular papillary base and submarginal incision. And the coronary repositioning flap is a technique used in drawing suturing to assist in covering the root surface of the receded gingival margin. So the aim of this study was to investigate the impact of a flap design with or without coronary repositioning flap in soft tissue healing and crystal bone remodeling. In the soft tissue assessment, they are looking for gingival margin level if they receded or in the same position, or coronary repositioning. The second thing is scar formation, is it present or absent? And the third thing is papillary height, is in the same level or receded. And in the radiographic assessment for crystal bone level, they looking for in the CBCT the distance between CAJ to the crystal bone at the mid-root in the facial aspect of the tooth. And the result that find from 47 patients that the gingival recession was more prevalent in mandibular teeth, as we can see in these images. That's most prevalent in mandibular teeth, molar teeth, and teeth that receive intracircular or papillary base incision. And the scar formation was affected by flap design, and coronary repositioning flap was the only technique resulting in coronal root coverage. And there were no change observed in the papillary height between various flap design. And there is no statistically significant difference in the crystal bone height between preoperative and follow-up scan measurement. In conclusions, that the soft tissue change are evident after endodontic microsurgery and can be affected by flap design selected, as well as site began treated, and application the coronary repositioning flap can improve the position of the gingival margin level after endodontic microsurgery. And there is no significant changes in the crystal bone level of the root after endodontic microsurgery. And thank you.